Is he ready? My name is Dr. Bernee Dunson. I've been placing implants since 1993. I've been doing bone grafting since 1996. I did an implant residency for 3 years at Loma Linda. And I also did a GPR at Columbia University in New York City. Here's my experience. I've harvested bone from the hip with orthopedic surgeons. I've harvested bone from the knee with orthopedic surgeons. I've harvested bone through the chin myself, and I've harvested bone through the ramus. I'm embarrassed to say, I've even in one of my residency training programs, we harvested calvarian from the head, okay? It didn't work at all right? Here's my experience. Harvesting bone from the hip, in my experience in New York, I would be the person on call who'd have to go provide the steroid middle of the night. We did a bilateral sinus graft on a patient, harvested from the hip, did successful grafting in the maxilla. I went into the patient at 3:30 in the morning, took a look at her, and I was elated that everything was healing fine. I was leaving her room. She shares with me, Dunson, my last name, Dr. Dunson, right? I said, yes, you come back here. You look at my hip. My hip's killing me. I don't have any problems with my mouth. So as I walk back to my call room, I ask myself the question, there's gotta be a better way. There's gotta be a better way. Some 2 or 3 years later, I met a guy named Dr. Hill Tatum. He trained me how to be proficient in doing the sinus graft procedure. Obviously, he's the pioneer who created it, so it was great for me. He was using Rocky Mountain Tissue Bank, the irradiated cancellous at the time. So this is in the late 90s. I start using that. 4 months later, I'm loading, placing implants, having tremendous success with irradiated cancellous bone, all right? Fast forward some 10 years later, 2006, 2007, Rocky Mountain starts to produce these vertebral blocks. This becomes an opportunity for me to experience something different because harvesting from the chin, I dealt with a case with ptosis, I dealt with a case with paresthesia, and those aren't cases you want to live in your practice life because as a clinician treating private practice patients or any patients for that matter, your goal is to do no harm. Here I am trying to use a graft to build bone in a different area of the mouth, and I did harm because I harvested bone from a different site and I had morbidity, all right? The blocks became available, changed my life, changed the game. One of the things I like about them, different from the bone blocks that we harvested, is how you can handle these blocks. They're a lot more malleable. You can carve them, you can shape them, you can position them and kind of nestle them into the recipient sites that you're trying to achieve. It also eliminated a need to create a prep to do a graft. My results have been, my experience have been, I've been in 2 settings. In Puerto Rico with Dr. Tatum and Dr. Pedroza, in Minnesota with Dr. Resnick, witnessed and evaluated the histology, which shows that this block turns over very well, very much like natural bone. 4 months you get about 59, 60% bone turnover. The recent studies by Dr. Resnick, which are great, wait 1 more month and you're going to get a much higher turnover of vital bone versus grafted bone. So here's my reality. When my mom needed a graft in her premaxilla, I used Rocky Mountain Tissue Bank. If I can use it on my mom, who I love dearly, she's one of my greatest heroes along with my dad, I feel safe to use it in any patient that I have the privilege to treat. I can share with you this. I've looked at different bone banks throughout the country, throughout the world. I visited Rocky Mountain Tissue Bank. I went in the mind's eye of being an inspector. One of the concerns people have with allografts is, are they safe? Well, the way in which they go through a stringent process of evaluating the patient, the potential donor, is very stringent. The process of the irradiation is very meticulous. The bone bank is immaculate. I teach there at times, but my mission when I went there was to see how safe this was. What I can share with you with extreme confidence is this is a graft that works, it's predictable, it's practical, and from that standpoint, it creates what I would classify to be great profitability for me to be able to take care of patients. Thank you for the opportunity to share, and welcome to the 5th annual Global AAID Conference.